Abrupt relapse of ALK-Positive lymphoma after discontinuation of Crizotinib. Definition: Anaplastic large cell lymphoma is a rare T-cell lymphoma seen in both adults and children. This aggressive lymphoma is more prevalent in males and can present with extranodal involvement and immunophagocytic lymphohistiocytosis.
Lymphoma is a family of blood cancers, and at its simplest level, you can think about it as a cancer of special white cells called lymphocytes. Lymphocytes come in two major categories, B cells and T cells, and then there's also a third less common category called NK cells. At any point, if these white cells turn into a cancer, we call it lymphoma. Anaplastic large cell lymphoma is a subtype of peripheral T-cell lymphomas. This is not a very common disease, and it comes in two different varieties. One is called ALK-positive anaplastic large cell lymphoma, and the other is called ALK-negative anaplastic large cell lymphoma. Both types typically affect lymph nodes, but there are some differences both in terms of the age group of patients who are at risk for it, as well as the overall outcome. In general, people who have ALK-positive anaplastic large cell lymphoma tend to be younger. It's something that can be seen even in pediatric populations, and they tend to respond somewhat better to treatment than those patients who don't have the ALK protein. For ALK-negative anaplastic large cell lymphoma, the average age is over 40, and sometimes the treatment works, and other times the disease may return despite the initial treatment. Anaplastic large cell lymphoma is a non-Hodgkin lymphoma, and as all lymphomas, it's a blood malignancy. And what that means is that our treatment generally involves agents that must travel through the blood, and our standard of care is chemotherapy. CHOP, C-H-O-P, which is cyclophosphamide, doxorubicin, vincristine, and prednisone, has been the standard of care for patients with anaplastic large cell lymphoma that is newly diagnosed. Occasionally, another agent, etoposide, will be added in, particularly for patients under the age of 65. Considering how rare anaplastic large cell lymphoma is, I think it's critically important that patients seek out clinical trials wherever possible. The treatment backbone that we have for anaplastic large cell lymphoma is CHOP, and this was based on studies that were done several decades ago and primarily in patients with B-cell lymphomas. Although it's an effective treatment, clearly we would like to do better, and participating in a clinical trial is a very important treatment option for patients with anaplastic large cell lymphoma. Patients with anaplastic large cell lymphoma should know that there are resources available. This is not a very common disease, and it's important to recognize that not all treating physicians will have experience with managing this particular lymphoma. I would strongly suggest that patients who have anaplastic large cell lymphoma seek out other resources, and this includes nearby universities, or asking their physicians to contact nearby universities, and to go to lymphoma.org, where there is a wealth of information both on the disease and on managing the disease. I recommend lymphoma.org to essentially all of my patients. I found that it's been an extremely important tool for my patients that provides them support and links not only to information about their disease, but to other patients who are living with the disease.
The Lymphoma Research Foundation initially helped me gather information, which was extremely helpful. After I had progressed through my treatment, I wanted to give back to the cancer community, and one of the things I chose to do was to become involved with the Lymphoma Research Foundation. The Anaplastic Large Cell Lymphoma mini website is an excellent source of information about ALCL. In fact, it's the only resource of its type that I'm aware of. There are profiles of patients on it. There is background on the disease itself, a discussion of treatments. It's really a great resource for people with ALCL.
Crizotinib. Crizotinib is a targeted therapy. This drug is an oral inhibitor of receptor tyrosine kinase.
The rate at which chemistry continues to evolve is astounding. From the patients receiving treatment to the scientists working tirelessly to make pioneering discoveries, everyone is affected by chemistry in a lasting way. Tonight we honor Jean Sui, Pei Kung, Mason Parrish, Hong Shen, and Michelle Tran Dubé, a group of medicinal chemists from Pfizer whose innovations have led to the discovery of Crizotinib, a revolutionary non-small cell lung cancer pharmaceutical agent. Lung cancer is the most common form of cancer, with an estimated 220,000 new cases in the United States in 2011. Approximately 85% of all lung tumors are non-small cell, and 5% of patients harbor the EML4 ALK mutation. This mutation is most prevalent in patients who have little or no prior history of smoking and develop the disease at a young age. Crizotinib is an important therapy for patients harboring the EML4 ALK mutation. The team at Pfizer utilized structure-based drug design and a new medicinal chemistry design concept focused on minimizing unproductive lipophilicity to improve potency, selectivity, and pharmacokinetic properties simultaneously. A key design transformation occurred by replacing an oxindole ring present in the original lead structures with aminopyridine, enabling substantial molecular weight to be removed from the series. These smaller, more polar compounds demonstrated greatly improved pharmacokinetic properties. Subsequent structural modifications to further improve potency and molecular properties led to Crizotinib. Crizotinib demonstrates significant clinical efficacy for non-small cell lung cancer patients harboring the EML4 ALK mutation. The first published clinical study of Crizotinib showed a 57% objective response rate and an estimated probability of 6-month progression-free survival at 72%. Crizotinib was launched in September 2011 after approval by the FDA earlier in the year. Crizotinib is the first new small molecule drug for lung cancer approved by the FDA in more than 6 years, and is among the first cancer medicines offered with a companion diagnostic to enable appropriately targeted therapy, and represents a significant advancement in the treatment of non-small cell lung cancer. The American Chemical Society honors these heroes of chemistry from Pfizer for their outstanding contributions to science and their service to society.
Crizotinib has been shown to have therapeutic activity in relapsed and resistant ALK-positive lymphomas. Some patients receive treatment for more than 4 years without recurrence. Application in medicine, we describe one of the cases of abrupt relapse in patients with ALK-positive anaplastic large cell lymphoma after discontinuation of Crizotinib. The patient, a 26-year-old woman, began to receive therapy in June 2010. Complete remission was soon achieved, including negative results on quantitative polymerase chain reaction testing to detect the nucleophosphine ALK messenger RNA and a peripheral blood. In February 2014, Crizotinib was discontinued at the patient request, with the plan to receive NPM ALK levels with quantitative PCR testing 1 month later. After 18 days, she presented with fever, cervical adenopathy, and dyspnea. On day 23, treatment with Crizotinib was restarted at a dose of 250 milligrams twice a day. Pros and cons. In vitro studies confirm cytoreductive anti-tumor activity of Crizotinib in experimental model of anaplastic large cell lymphoma in 2007. One case series and a few case reports describe the use of Crizotinib in relapsed or refractory anaplastic lymphoma kinase positive, even though data are limited regarding the dose of Crizotinib in renal insufficiency.
Most of the patients that have advanced disease are not curable, and we're really trying to optimize their benefit while minimizing the detriments or the decrease in quality of life. Targeted therapy is allowed to select patients and really give personalized medicine based on someone's individual unique tumor biology and find a drug that triggers inhibition of a certain checkpoint that's causing cell growth. In doing so, you're able to limit the systemic side effects of chemotherapy and really able to develop a personalized treatment plan for each individual. Moving forward, I think erlotinib and crizotinib in lung cancer have shown dramatic effects in the first-line setting, and I think the BRAF mutation discovery in melanoma is leading to extended survival in patients with melanoma. Also, specific mutations in colon cancer are selecting for newer techniques, and it's allowing us to find newer discovery to target more pathways and have a better understanding of the biology behind cancer.
Issue apply in Ecuador. The activity of crizotinib in this disease, it suggests that long-term treatment with crizotinib is a reasonable option in patients who are not candidates for more aggressive therapy and indicates that crizotinib can be used successfully at reduced dose in patients with pre-existing renal insufficiency.
Anaplastic large cell lymphoma is not a very common disease. It falls under the family of peripheral T-cell lymphomas and accounts for maybe a third of peripheral T-cell lymphomas that involve lymph nodes. But overall, the incidence borders on just several thousand new cases diagnosed in the United States per year. In order to make a diagnosis of anaplastic large cell lymphoma, it's very important to have a large enough biopsy. Tissue is the only way to make the diagnosis. Considering how rare anaplastic large cell lymphoma is, I think it's critically important that patients seek out clinical trials wherever possible. The treatment backbone that we have for anaplastic large cell lymphoma is CHOP, and this was based on studies that were done several decades ago and primarily in patients with B-cell lymphomas. Although it's an effective treatment, clearly we would like to do better, and participating in a clinical trial is a very important treatment option for patients with anaplastic large cell lymphoma.
Conclusion. This experience suggests that single-agent crizotinib is a viable option for patients with relapsed or refractory ALCL who are not candidates for high dose of chemotherapy, and crizotinib could be successfully employed at reduced dose in patients with renal insufficiency.
Diffuse large cell lymphoma is the most common non-Hodgkin's lymphoma in the United States. This lymphoma usually occurs in older adults with a median patient age of 60, but approximately 20% of these neoplasms occur in children as well. Diffuse large cell lymphomas are most commonly of B-cell origin and are derived from the germinal center. The mature B-cell tumors express CD19 and CD20 markers and demonstrate variable expression of germinal center markers including CD10 and BCD-L6. However, approximately 20% of diffuse large cell lymphomas are of T-cell origin. Clinically, patients with this form of lymphoma present with advanced disease with extranodal involvement. It can arise virtually anywhere in the body, and primary or secondary involvement of the liver and spleen can cause the formation of large isolated masses. Common extranodal sites include the gastrointestinal tract, brain, skin, and bone. Histologically, these tumor cells are relatively large in size, often measuring 4 to 5 times the diameter of a small lymphocyte and have a diffuse pattern of growth. These tumors are aggressive tumors and are typically rapidly fatal without treatment.